Hi, welcome to our first video blog here at Activate Health and Wellness. My name is Rose Pignataro. I'm a physical therapist and I have a PhD in public health, and I'm a certified health education specialist. Bear with me, it's my first video entry, so I might be a little bit choppy here. And I'm having a bad hair day, but of course that is almost a daily occurrence down here in Southwest Florida with the humidity and the Latin blood, which makes for big hair usually. Anyway, I wanted to talk today a little bit about a topic that I'm very passionate about. I've been a physical therapist for a pretty long time, about 27 years, and in addition to being a certified health education specialist, my board certification is in wound management. So I see a lot of people with diabetes, and one of the reasons I decided to complement my doctorate in physical therapy with a PhD in public health was because during the course of clinical practice, I was seeing a lot of people that had complications of diabetes. Type 2 diabetes itself is highly preventable, and the complications of type 2 diabetes are also very preventable. A big key to that is making sure people have information that empowers them to take care of themselves in the proper manner. So, I don't know if you knew this, but I was sort of stunned by this statistic. The American Diabetes Association estimates that there are about 3,853 Americans every day newly diagnosed with diabetes. So that's huge. For me, it's actually a very personal topic. I have loved ones with type 2 diabetes. I have personal risk factors for type 2 diabetes. So I try to keep myself educated so that I can share that with other people, but also so I could take care of myself. The good news about knowing that type 2 diabetes is preventable to a certain extent is that some of the research shows that 40% of the risk of the disease actually comes from our own personal health behaviors. The top three things are proper nutrition and weight management, which sort of go hand in hand. And then along with that, which also goes hand in hand, is making sure that we get enough exercise or physical activity. So these are definitely things that we can control, hopefully by finding strategies that help us. Um, the big thing about type 2 diabetes from my perspective is that one of the top complications involves diabetic peripheral neuropathy. That's nerve damage to usually the feet and the legs, but sometimes also the hands, that comes from prolonged hyperglycemia or improper management of the level of blood glucose. So that's also preventable. You want to be able to monitor the blood glucose levels and take steps in collaboration with your healthcare provider to make sure that you're maintaining good control. Coming from diabetic peripheral neuropathy, the other big complication is diabetic foot disease. So sometimes people get changes in the skin of their feet, changes in the muscles, changes in the circulation and the moisture level of the feet that puts them at risk for wounds. So what we've decided to do is put together this brief 45-minute free course on how to prevent and manage diabetic foot disease. So that should be posted on our website, activatehealthandwellness.com, within the next couple of days. We hope that you'll check that out and provide us with some feedback, because we like to hear from our community members and about whether or not the information was valuable, your suggestions for how to present things. And also, if there are any other topics that you're interested in learning more about, we would really like your suggestions. So that's it. I'm wishing you a happy Wellness Wednesday. Thanks so much for checking us out. And don't forget to like and follow us and share with your friends if you think that they might find it interesting as well. Okay, be well. Thank you.